This picture, retrieved from CNN.com, is of Charlotte, a young girl who suffered from severe seizures that caused her to not be able to function. Charlotte's seizures were not controlled by prescription medications. However, there was something that helped Charlotte, and it was cannabis oil, a form of medical marijuana. Hello, my name is Tabitha Little, and today I will be doing my informative speech on the benefits of medical marijuana and how it can help people who are dealing with different illnesses like cancer and epilepsy. To begin, I will go over what medical marijuana is and give a little history on medical marijuana. NIH, National Institute on Drug Abuse, posted on its website that the term medical marijuana refers to using the whole unprocessed marijuana plant or its basic extracts to treat symptoms of illnesses and other conditions. It also explains that the two main ingredients that are helpful to people suffering from illnesses are THC and CBD. THC is the active ingredient in cannabis, giving it its narcotic and psychoactive effects and can increase appetite, reduce nausea, and maybe also decrease pain, inflammation, muscle control problems. CBD is a cannabinoid that doesn't make you high. It can reduce pain, inflammation, and can also help with seizures. Marijuana has been used for many years for medical purposes. According to an article on narconon.org, the first direct reference to a cannabis product as a psychoactive agent dates back from 2737 BC in the writings of the Chinese Emperor Shen Nung. The focus was on its powers as a medication for rheumatism, gout, malaria, and absent-mindedness. However, because of the misuse of the plant, the Controlled Substance Act of 1970 classified marijuana, along with heroin and LSD, as a Scheduled I drug, which means having the relatively highest abuse potential and no accepted medical use. After doing quite a bit of research, I have found evidence that shows that marijuana can be beneficial to patients dealing with illnesses and chronic pain. Now that we know what medical marijuana is and a little history on it, let's discuss some of the ways that it helps with different illnesses. First, I would like to start with the benefits that medical marijuana has on patients with cancer. Marijuana can help with nausea that comes from chemotherapy and can help patients by increasing their appetite. Many cancer patients lose a good amount of weight due to the side effects of chemotherapy. Marijuana can help keep their weight managed. It can also help with chronic nerve pain due to the side effects of cancer. Second, the benefits of medical marijuana on children who suffer from epilepsy. Epilepsy is a brain disorder that causes people to have seizures. Like I mentioned in the beginning, Charlotte was one of those children. According to an article on CNN.com written by Sandra Young in August of 2013, cannabis oil made up of high CBD and low THC levels helped a 5-year-old girl, Charlotte Figi, who suffered from Dravet syndrome, a rare severe form of intractable epilepsy. Charlotte went from having around 300 seizures per week to only having 2 to 3 seizures per month. After hearing of Charlotte's story, many families have moved to Colorado to see if this will help their children as well. There are also other benefits to using medical marijuana. Another benefit of using medical marijuana is that it can be used instead of pain medications. Certain pain medications, such as Oxycontin and methadone, are highly addictive and have led to numerous deaths over the years. The CDC posted on its website that in 2015, more than 15,000 people died from overdoses involving prescription pain medication. However, there have been no deaths linked to medical marijuana. As any drug, marijuana has side effects. It can be addictive. However, studies do prove that it is less harmful than pain medications. It should, like any other medicine, be determined only by a doctor if a person would benefit from this type of therapy. In conclusion, there are benefits to medical marijuana. As I have informed you, it can help cancer patients with pain and other side effects like nausea and weight loss. It can help children who suffer from seizures not controlled by prescription medications, and it can also be a safe alternative to pain medications. Thank you all for listening and have a great evening.